But before we do that, I wanted to start a little more local, and I wanted to get your perspective as the CEO of UC San Diego Health. What does the milk bank mean for our community here in San Diego?
So the milk bank is going to provide, needed donated breast milk for moms and babies that need it. Here and really in the western part of the United States, the single source for donated breast milk was in San Jose, and they've been completely inundated with requests. And so this will be the only Southern California source for breast milk that we can be able to provide not just breast milk for our region, but for Southern California and even Northern California and beyond. So I think the impact of the milk bank will be not just for San Diego, but for really Western United States.
That's great. Thank you. And is there a benefit? My understanding is that this is going to also allow us to partner with other health systems. Is that a benefit for UC San Diego Health, that we'll be able to also provide milk to places like Sharp, like Scripps?
I think that when we have the opportunity to provide specialty services that nobody else in the region can provide, that's great for UC San Diego Health, but it's even better for the region. We don't have to be competitive about everything in healthcare. In fact, we should really be competitive about very little. And our ability to provide services to our, in some ways, our chief competitors, but also our peers and colleagues and our families and our communities, really transcends everything. And so our commitment to the community and the region at large is really a great opportunity, I think, for everybody.
Thank you. So now I want to go a little bit broader. So I know that the partnership with UC Health has been something that's really special, and I know that a lot of that was driven by conversations between you and Dr. Stillwagon and Dr. Byington up at UC Health. Can you kind of talk me through what that collaboration means for UC San Diego Health as the host of the milk bank?
So we have the honor of being the host of the milk bank, which is now sponsored by all of UC Health. And this is actually the very first service that is sponsored across all of UC Health that is really a precedent-setting opportunity. So that's just thrilling that we were able to bring that forward under Dr. Stillwagon's leadership and her great vision, and being able to bring that forward to all the other UC Health systems has been really a great honor for us.
What does it mean for you personally? As I was saying earlier, my understanding is you've been really passionately involved with this project, and I'm curious what drives that.
My personal passion for this starts with just tremendous support for Dr. Stillwagon and her vision to create something that's transformational in the region, and to support our donors and their support of this tremendous vision. But it also comes down to things really personal, I think, to me. My best friend had a baby at Jacobs Medical Center a couple of years ago and really struggled with breastfeeding, but was really committed to needing to provide mom's milk for her baby. And so I saw how that really transformed her care for her own child. I'm passionately supportive of breast milk, always have been. And so it just fits in kind of my personal area of commitment.
Thank you. And my last question is, you mentioned the community really kind of being behind this, and I'm curious, what is the importance of our local and our regional communities' support of this initiative? How would you encourage people to join in and be a part of this?
The success of the milk bank is really dependent on full support from the community, from donating moms, accessing our website and making those donations, to sharing the news and sharing the passion, and really leading the way for best care for our babies. So it's a real community effort.
For you personally, like as a mother, what does it mean to have this resource in San Diego?
It's hard sometimes to separate my role as CEO from my longstanding role as mom. And so it's hard not to think about how you support the region from a mom's point of view too. And I just think this is tremendously important as a resource for our community, for our moms and for our babies. And if it wasn't for Dr. Stellwagen's tremendous vision, I don't think this would have come to pass. And I'm incredibly grateful to her for all that she's done.